All right, let's dive in. Today, we're putting on our detective hats to investigate a true medical mystery, a disease that's famously known as the Great Imitator. We are talking about lupus, and our investigation starts right now.
I know, it sounds like the start of a pretty strange riddle, doesn't it? But stick with me, because the answer to this question connects basically everything we're about to explore. It holds the key to the name, the most famous symptom, and the very nature of this really complex condition.
And there you have it, the first piece of the puzzle. Lupus is literally Latin for wolf. Way back when, doctors thought the classic red rash some patients get on their face looked like the bite or markings of a wolf. And that's how the disease got its ancient and kind of intimidating name, the red wolf.
So what does this all boil down to? Well, it's basically a case of friendly fire. Your immune system, which is supposed to be your personal bodyguard, right, fighting off germs and viruses, it gets confused. It completely loses the ability to tell the difference between a foreign invader and your own healthy cells, and it starts attacking itself.
Okay, so just when you think you're getting a handle on it, our investigation gets a little more complex. See, lupus isn't just one single culprit. It's more like a family of related conditions. Let's take a look at the four main suspects.
As you can see, lupus shows up in a few different forms. You've got discoid, which pretty much sticks to the skin. Then there's drug-induced, which is a temporary reaction to certain meds. And neonatal, which is a rare form that can affect newborns. But the one we're zeroing in on today, the main event, is the most common and complex one, systemic lupus erythematosis, or just SLE.
So let's zoom in on our prime suspect, SLE. This is the one most people are talking about when they just say lupus. And it's called systemic for a reason. As we're about to see, it can affect nearly any system in the entire body.
Now, one of the most striking clues about SLE is who it affects. The disease has a very clear preference. It's kind of shocking, really. For every one man who gets diagnosed, you're looking at roughly 9 or 10 women. And it most often appears during their childbearing years, usually between 15 and 45.
And this right here is why SLE has earned that nickname, the Great Imitator. It is a true master of disguise. Because it can pop up in so many different parts of the body, the symptoms can look like a dozen other illnesses. Seriously, no two cases are exactly alike, which makes it an incredible challenge to diagnose.
Just look at this list of potential targets. It's staggering. It can be something general, like fatigue, or it can be painful joints. But it can also cause serious problems with the kidneys, the heart, the lungs, and even the brain. This is what systemic really means. The attack can happen anywhere, creating this confusing jumble of symptoms for doctors to try and sort out.
Okay, let's clear up something that trips a lot of people up, the joint pain. While SLE definitely causes arthritis, it's usually what we call non-erosive. That means it causes pain and swelling for sure, but it typically doesn't destroy the joint cartilage permanently the way rheumatoid arthritis does. It's a subtle but absolutely crucial distinction in this investigation.
And here we are, back to the second part of our opening riddle, the butterfly. This is that iconic malar rash. It's famous for a reason. And what's the key diagnostic clue? It drapes across the cheeks and the bridge of the nose just like a butterfly's wings. But, and this is the important part, it almost always spares the smile lines, those folds that run from your nose to the corners of your mouth. That little detail is a huge clue for doctors.
So, with a suspect that's a master of disguise, a true shapeshifter, how do doctors ever actually crack the case? Well, it's all about following a very specific trail of evidence.
I mean, this is the big question, right? For every doctor faced with a potential lupus case, it's not about finding one single piece of evidence. It's about piecing together a whole pattern of clues that all point in the same direction.
The process is really methodical. It's not a shot in the dark. It starts with gathering clues, listening to the patient's story, doing a full exam. Then they run some screening blood work to look for general signs of this kind of autoimmune activity. After that, they look for specific fingerprints. These are antibodies that are almost unique to lupus. And finally, if they need to, they can confirm the diagnosis by taking a tiny tissue sample.
So the first big test is for something called ANA, or anti-nuclear antibodies. Now think of this test like a really, really wide net. It's great because it's super sensitive. It catches more than 95% of people with SLE. But it also catches a lot of other things too. So a positive result doesn't automatically mean you have lupus. It's a fantastic test for ruling lupus out, but it can't by itself rule it in.
But these are the smoking guns. This is the forensic evidence of the investigation. Tests for these two antibodies, anti-dsDNA and anti-SM, are highly specific to SLE. If a patient has symptoms and these show up in their blood, it is a very, very strong sign that lupus is the culprit.
So at the end of the day, a final diagnosis is kind of like a prosecutor building a case for a jury. It's not built on just one piece of evidence. Doctors use a checklist of clinical symptoms and lab results, and a diagnosis is made only when a patient meets enough of those criteria to confirm a clear, consistent pattern of disease.
All right, so once the case is cracked and the diagnosis is in, the mission changes. It shifts from investigation to management. How does a person live with the wolf?
And this is the modern reality of lupus. While there's no cure at the moment, the outlook is so much better than it was just a few decades ago. The whole focus of treatment is to manage the immune system, control those flare-ups, and get the disease into a state of remission, where symptoms are either minimal or gone completely.
So managing lupus really requires a team approach. Sun protection is absolutely non-negotiable because UV light is a huge trigger. Then there's medication, which is carefully tailored to each person's unique symptoms. And of course, lifestyle stuff like managing stress, plus regular checkups are all key to keeping things under control. And because this affects so many young women, family planning is obviously a major concern. There's a really critical piece of guidance here. Doctors strongly recommend that the disease be in remission for at least 6 months before a patient even thinks about trying to get pregnant. This just dramatically improves the chances of a healthy outcome for both mom and baby. And that really brings us to our final thought. The investigation into lupus teaches us about this really profound paradox in our own biology. It shows us this razor-thin line between our immune system's power to protect us and its capacity to attack us. It really makes you wonder, what other secrets about our health are hidden in this complex internal battle?